At what follicle size should we trigger ovulation? This large clinic based study addresses a common yet crucial question: when it is the best time to give a trigger shot in women undergoing intrauterine insemination with letrozole, specifically when one follicle is growing. Now, letrozole is widely used to help women to ovulate by stimulating the ovaries to produce follicles. In intrauterine insemination, doctors use ultrasounds to measure the follicles and wait for the right moment to trigger ovulation. There's a debate about the exact follicle size and giving the best chance of pregnancy. This study followed 724 treatment cycles where letrozole was used, where only one dominant follicle developed. Most women were in their early 30s and had either unexplained infertility or difficulties in ovulation. Researchers grouped cycle depending on whether HCG shot was given and when the follicle was less than 19 millimeter, between 19 and millimeter and 23 millimeter, or 24 millimeter and bigger. The results were clear. Triggering ovulation when follicle measured between 19 and 23 millimeter produced the highest pregnancy rates. For example, rates rose from about 13% with a 19 millimeter follicle to almost 19% to follicles reaching about 22 millimeter, but then dropped again for smaller or larger follicles. These findings were consistent, adjusting for age, body weight, or diagnosis. Why does it matter? Because there's a wide range, and much of that is in IVF based of triggering at 18, while in nature and in letrozole and clomid, that data is not very good. Why is it important? Because it's one of the few studies which looks at using a large sample size to create a real life scenario of a single follicle. It's also important that small follicles don't often give rise to mature eggs. We know that through IVF, but even large follicles may not also give rise to good pregnancies. And we can use this to fine tune our letrozole cycles. What is the risk here? That some women would ovulate when the follicle size reaches 18 to 19 millimeter and not wait for a larger follicle size.